Well, Dr. Michael Mangonon, thank you once again for talking at the GOMA conference. This is the 2019 fall conference. We brought you back. Everyone was very happy with your talk at the Rome conference.
I appreciate that.
Tell everyone a little bit about your practice, if you don't mind.
So I'm with Atlanta Hand Specialists. We are a hand surgery group, general surgeons trained in hand surgery, and we're here in the Atlanta area. We have multiple locations: Douglasville, Smyrna, Marietta, Canton, East Cobb, Lawrenceville, and where are we now? Johns Creek, yeah, Johns Creek, yeah.
And so which office are you working at?
So I am in the Johns Creek and Lawrenceville offices.
Okay,
yeah.
good. All right, so Gwinnett County.
Yeah.
All right, super. We talked about Dupiytren's contractures.
Yes, that's right.
Why don't you talk a little bit about recurrence rates for the different procedures? And so, I mean, in all fairness, it's really the surgical procedures that really do the trick.
Yeah, surgery.
Procedures,
surgery in this case is what's more reliable. You know, what gets a better result, what has a lower recurrence rate. There are things out there that are less invasive, you know, less burden on the patient, but because of high recurrence rates, you know, they don't have the same result that you want to have for your patient sometimes. You know, there's needling out there, there's enzyme injections, and you know, yes, they get that quick result that all patients want, but sometimes you also want to maintain the longevity of the procedure that you're going to do. All right, if something more invasive is going to have a better long-term outcome and less risk of injury to structures or complications, then you know, maybe that's the better thing to do. But it's something that you have to discuss with the patients so that they have a better expectation. Unfortunately, Dupiytren's is a genetic disease that, you know, we don't have a quote-unquote cure for.
Sure.
So we're just trying to manage it, and you know, we're working against the body essentially.
So you were saying that statistically, if they do the needling, it's something like 80% chance of recurrence.
It's about 85% chance
85%
nowadays. Recurrence rate, yeah.
The enzyme is something like 50
to 60% recurrence rate.
And then surgery, it may be a 20% chance.
Still 20%.
Right.
Still a high number.
Still high, but
Yeah.
80% chance that they won't have recurrence.
Yeah. Yes.
All right. So it's all a matter of how you package it, right?
Yeah. You gotta make it. You know, you give the best results. You know, to the patients, and you know, you work together. You talk together. You come up with a plan. You know, not everyone who has a contracture, you know, needs to have something done.
Sure.
You know, somebody much older, less function. If it's not a matter of hygiene, maybe nothing needs to be done. Okay, younger patients, you know, if it's starting to bother them, cause any problems with function, then yes, doing something sooner than later so you don't lose function, and then you can maintain function for, you know, a lifetime, which is what we all want.
Sure. Well, once again, thanks for sharing your knowledge.
No problem.
We greatly appreciate it.
You're welcome.